So, Ian Chorlton, what is the difference between option 2 and option 6, and why have you decided to do option 2 before you do option 6?
So I think the debate at governing body this morning was describing a journey and how we move forward on that journey. And option 2 gives us very practical things to do in the here and now, recognising some of the issues that we have within our system and practically trying to work out and solve some of those problems. So we're talking in option 2 around Section 75 agreements, about how we can use those in a more joined up way for the benefit of our population and have better outcomes. That's a really important first step towards option 6, which is a much more joined up integration of health and social care, and governing body of the CCG supported that move towards option 6, but want to see some practical solutions and practical answers in the short term, and this was felt to be a really good, straightforward way of moving on that journey.
Now, as you say, because you've had an apology from the leader of the council over some confusion, some would say chaos really, at County Hall over the language that's been used there in recent days, where they have really got rather confused between option 6 and option 2. They've now come out and said, though, that they're definitely still keen to do option 6. Aren't they going to be a bit disappointed that you're not in lockstep with them on that?
We are in lockstep with the Cornwall Council as one of the 4 commissioners of health and social care in Cornwall and the Isles of Scilly. So that's the Council of the Isles of Scilly and NHS England, who commission very specialised services. And the language was not around option 2, difference between option 2 and option 6. The confusion around language was around the interpretation of accountable care organisations and takeovers. And what the council wanted to do was to really put out a very clear statement that this was not about any form of takeover. And there was some misinterpretation of the words in what was put out, and the apology from the council was around that, around the use of language. But this is not about rejecting option 2 or any such thing. It's around trying to get common ground and understand language. And I think, as was discussed in governing body this morning, that the local authority have a different view of what the word shadow means as opposed to my colleagues on the governing body. To us, shadow meant.
Well, let's clear that one up, because the council's trying to launch something in shadow form on the 1st of April. What's your understanding of what they're launching in shadow form on the 1st of April, and what's NHS Kerno doing on the 1st of April?
So the 1st of April is, and let's move away from the set dates and lines in the sand and we'll do this by this date or that by that date. What shadow is about trying to test and learn and to try and understand how we have conversations together. And we heard this morning how certainly our finance teams across all of our providers have seen the benefit from getting into a room, understanding what each other's issues are, and then coming up with a solution together. So that's what shadow means. It doesn't mean creating a new form or a new function or a whole new structure or a whole new organisation. Shadow is about trying it out and trying to test what our understanding is and trying to come to sensible conclusions and decisions on behalf of our population.
It was interesting to hear some of the doctors expressing their concern that the council's ambitions are really driven by their political interests in their devolution agenda, and that actually that's not going to really improve anybody's health on its own, the devolution agenda. That's a decision best left. How to make people better is something that doctors do, not politicians.
I think I'd challenge that, or I would challenge that. So devolution gives us the opportunity around how we can influence what we know as wider determinants of health. So at the risk of speaking in language that people don't understand, it's around what can we do to try and prevent ill health, what can we use planning for, what can we use local policy for around trying to address obesity and to try and get people to be healthier in their lives, and what can we do in a more joined up way. And it's not about what a health provider can do in a big acute hospital. We have to really recognise that we have large numbers of people in England, but very particularly in Cornwall and the Isles of Scilly, who are living with high levels of obesity, who potentially are going to develop diabetes in the next 5 to 10 years. And really our challenge as strategic commissioners is to see what can we do to try and help people to help prevent what are disabling long-term conditions.
I would say, though, that the mood and atmosphere of today's meeting is far more cautious than anything I've heard at County Hall about that. So, I mean, do you think that's fair, that your board is perhaps even verging on suspicious about what's going on, rather than the headlong enthusiasm that we see in Truro?
I would say that the board is, at the governing body, is supportive of wanting to try and get this right, to see what we can do together to work together in a better way, and we call that integration. It's not about creating some new super organisation that's going to take over somebody else. It's about really understanding what our issues are today, how can we solve those together today, and that's really what option 2 talked about, and how can we make better sense of what we call section 75 and get a better deal for our population, with all the time having that longer term view to move to what is described in option 6, which is a much more cohesive and joined up way of thinking and trying to solve problems together.
When do you think we'll get to option 6?
Well, I think it's in the paper. It talks about having a full business case not before September, so that we're not expected to have that in September. And what I'll be looking for, and what our governing body are looking for, is a regular feedback and update and assurance in our regular papers about what our progress is. And they'll be looking very particularly at how do we sort out and solve the Section 75 problem that we understand to be the issue at the moment.